Mr. Question.
Thank you again, Mr. Chairman. We all have a good number of questions. The first one that I have, I guess, in listening to the response, Mr. Bouvet, to Mr. Green's question, if there was one message you could send up the chain is, we'd like to have something maybe earlier than 2017. That's a long ways off. And I would like to think that maybe there can be a little extra push to try and get that so communities can figure out where they need to go. So whether it's a proposed rule or something that can be out there that can help, I think that would be important. Question that I have, I guess, for each of you quickly is, so we passed, as I indicated in my opening statement, H.R. 4470 pretty darn quick. I mean, Mr. Kildee had some good ideas. We refined them a little bit. We had, I thought, some constructive ideas. We've worked with Mr. Pallone and the committee staff. It was bipartisan. We didn't have the hearings. We didn't have a markup. We moved it right to the floor. And I think, again, leadership on both sides. We passed it under suspension like that. And, of course, we're waiting for the Senate to take some action. It's now been about 2 months since that happened. So now if you had this extra 2 months, again, we did this pretty quick, what changes would you make? What things have you discovered that we might have missed when we moved that bill so quickly out of here that we might want to think about? Anything?
Well, the agency is certainly very grateful for your and the committee's work on providing additional authority for prompt public notice for systems where there are lead action level exceedances. I don't have specific suggestions to offer at this moment, but we'd be more than happy to provide technical assistance.
That would be great because, again, it's languished over in the Senate, and at some point we're going to, I hope, come together and Dr. Laurie, and I just want to say, too, for the record, you and I have met a number of times. We've had a number of conversations. We really appreciate what you've done. The directive that you had from the President, your weekly trips that are there, you're working with all layers of government. We appreciate your testimony today and what you're trying to do, your expertise. But I'd be interested in if you have any thoughts in terms of what we might have added, and knowing that we've been a couple months since we passed this in the House.
You know, I think it's a great question, and you know, my first observation overall is that public health and water are obviously tied very closely together. A clear message from this is that disinvestment in the public health infrastructure has consequences, and a clear message, I think, going forward is the importance of preventing exposure by a strong early warning surveillance system to detect elevated blood levels, stronger surveillance efforts, and faster action on the lead mitigation issues. Here, moving forward with a registry to track all kids, finding kids who might be having trouble and being able to jump on them quickly is going to be terribly important.
So here's a follow-up question as I watch the clock. What percentage of kids in Flint, knowing that this is a national story, folks in Flint know about how many families, how many kids have not been tested in Flint? What, by a percentage?
You know, I am at the beginning of this crisis, and
because,
I asked Mr. Lyon to help. About 60% of kids on Medicaid had been tested, although there is a universal screening recommendation. With the more recent testing, most of the lead was probably out of kids' system, but it was very important for us to find any remaining kids who still had high lead levels. Moving forward, testing all kids per the universal screening recommendations and getting on those high lead levels within 2 weeks is going to be critical.
Mr. Lyon?
She's exactly right. We were approximately 60% in our Medicaid program. We instituted some enhanced elevated blood level testing, especially after October 1st when this occurred. We've tested thousands of children. What we've seen is the rate is somewhere below 2%. So we were following up with those children, but as has been indicated,
2% with elevated lead levels. 5%. Okay.
With that in mind, it doesn't measure past exposure. So what we've done is we've really taken our focus and said that we need to have the services in place that could potentially serve any child in Flint, because we don't know what their exposure may have been prior to the recent blood testing.
Okay. My time has expired. I'll prepare some other questions for the written record and yield back. Thank you.